As the COO of RN Cancer Guides, I'm here because my background is primarily in operations and healthcare administration. And I use my experience, which was overseeing medical facilities and surgery centers, and I put that into day-to-day use here in the operational aspects. At RN Cancer Guides, our focuses are threefold. Our primary and the founding focus for RN Cancer Guides is our private patient program. And what that means is that we will provide an oncology certified nurse. This is somebody who is an RN first and then takes the certification course to become oncology certified. And they work with our patients face-to-face in their home with their family members to deliver navigation and advocacy. That program includes a lot of education. It includes a lot of administrative assistance. And by that I mean dispensing information to all of the providers so that they're all on the same page. It also includes coordination of their care. So whether it means scheduling appointments and coinciding radiation with a scan or lab work with a follow-up, things like that are all coordinated. We also have unbelievable access to community resources. And these resources might be financial or legal. They might be resources that provide neuropathy treatment for patients. These resources can include home care, senior care, transportation services. We provide caregiver services. All of these relationships that we've worked very hard to focus on across the state of Florida are developed, they're vetted, and they're constant. And so these are people that we have established relationships with and feel are going to give our clients the best possible care. This private patient program provides navigation and advocacy that extends far beyond just that of assisting the patient, but assisting the caregiver as well, by taking stress off of them so that they no longer have to worry about maintaining the medical records, so that they no longer have to worry about how do I go to the appointment with mom when I have to be in a meeting at the office at the same time. We'll attend the appointments with mom. We will then even go home with the patient and invite them to bring in all of their family members and loved ones so that we can give a clear, understandable explanation of what the options are, or what the diagnosis means, or what the treatment will entail, or what type of support services they're going to need as they, go through this treatment or this process or this diagnosis. And our private patient program is really the foundation for what we do at RN Cancer Guides. Our second program is the Patient Medication Compliancy Program, and this is where we partner with specialty pharmaceutical companies. There was a law passed in Florida called oral parity, which means that oral chemotherapy drugs, which were once covered under your pharmacy benefit, meaning that they could be given and charged or billed in that tier structure, where it was either something that was on the list and covered, or it was off the list and you paid an astronomical price. Those drugs are now actually going to be covered under your medical benefit, which means that they're going to be more affordable. And because of that, there's going to be a great increase in oral chemotherapy drugs that are being prescribed. Now, what happens with that drug is no different than what happens with IV chemotherapies. So when you're in a facility or a clinic and you're getting chemotherapy, such as myself, how I received it, I went in and I had labs drawn. I had a physician who then reviewed those labs to make sure that I was eligible to take my chemotherapy that day. That prescription then went to a pharmacist who made sure that my height, my weight, my cell density and fat ratios and all of those crazy things made sense for the prescription that was written. The drug then is filled by the pharmacy and sent to another oncologist who makes sure that everything is right with it, that I'm getting the right drug for my treatment. Then that bag, or those 6 bags in my case, go to the person who's going to administer them, who's a nurse typically, in the oncology department, and she is gowned up like some Martian. Masks, gloves, dress. She then takes that drug, hangs the bag on the rod, and sets all the items up. Puts the port the port piece in, and the drug is administered. So there are all of these fail-safes. There are so many stops to make sure that everything is happening appropriately. Oral chemotherapy is just as dangerous as that chemotherapy that physician or nurse gowned up to provide to me. And yet people are going home and receiving this drug in the mail, not recalling the information that was probably provided to them by their physicians, outlining just how dangerous this drug can be. So with the Patient Medication Compliancy Program, anytime a prescription is written by that specialty pharmaceutical company, they notify us so that one of our oncology certified nurses can go to the patient's home upon receipt of that drug and do an hour-long educational session. During this session, they're going to remind that patient just how dangerous that drug can be. They're going to educate them on proper handling techniques. They're going to do certain assessments to make sure that barriers aren't encountered, such as learning assessments. Can the patient even read the medication bottle? Do they understand the importance of taking the drug exactly as administered or written? Those drugs sometimes can be costly still, and you may have a patient who says, oh, I'm not going to take it today, I'll save it for tomorrow, and then it'll last longer. But with oral chemotherapy drugs, they're prescribed on a 24-hour cycle. So as soon as somebody misses their dosage, they've just given that cancer cell time to duplicate and replicate itself. And so they're hindering the outcome that we're looking for. They also do assessments to identify if there are any internal or home barriers that need to be overcome. Do they have somebody who's pregnant who's going to be handing them the pill every day, like their daughter or their granddaughter? Is their spouse going to have something in the household that is going to interact, such as smoking? Or is it going to be grapefruit juice, which will counteract the drug itself? So, the spouse can't give that person grapefruit juice in the morning like they used to every day. There are so many things that we as patients don't know about chemotherapy, and especially when it's, again, received in the home. And this Patient Medication Compliancy Program helps to overcome those barriers and produce greater outcomes for the patient through education. Our third and final program is our corporate program, and this is the one that I have the most direct contact with. It's called an ECAP, Employee Cancer Assistance Program, and it's the first of its kind in the nation. We've all probably heard of EAPs, Employee Assistance Programs, that typically focus around mental health. What it typically does is provide like a hotline that you can call into, and then you can get a referral to somebody in your area who can assist you with financial, legal, mental health questions or concerns. Well, with our ECAP program, we are focused specifically on the employee who has cancer themselves or the employee who's a caregiver of somebody with cancer. What we've done is a ton of research on how cancer impacts the workplace. And we found that not only is it impacted the workplace because you may have an employee who's out of the office dealing with their cancer care, but you also have employees who are working through cancer treatment now, who have a great impact on productivity, as well as workers' comp issues, accidents, irritability, which may cause HR concerns. So there's a really great impact on the workplace. We've also found that lost productivity by caregivers is astronomical. And basically the impact in that capacity is that you have somebody who's not the patient, but is in the office dedicating work time to coordinating care, to gathering medical records, to researching clinical trials, to trying to schedule appointments. And all of those caregiver concerns are impacting business and productivity and successfulness. And so with our ECAP program, we have found a way to assist both of those aspects. As a patient with cancer, you can take the time that you're in the office to actually focus on work because you've got this advocate who is working behind the scenes for you. As a caregiver in the office with an ECAP program, you can do the same thing. You can focus on your work. You can focus on being productive because you know that even if your spouse is at an appointment and you can't be there with them, you can go home and you can get the insights from that RN Cancer Guide who's going to tell you exactly what happened at the appointment, who's going to break down all of the options, who's going to help you and your wife or your husband or whoever that caregiver is to make the best possible decision for their own treatment choices. This ECAP program provides, at this point, 100% return on investment, which means that for the contract that they sign with us, which provides these oncology certified nurses, it is paying for itself in claims reduction. That does not identify even the intangibles that it is affecting, such as mental health claims for caregivers, such as reduced turnover in the employees who are picking up the slack when that patient or caregiver is out of the office. So there's a great impact in the workplace by our navigators and our advocates who are these RN Cancer Guides. And what we're seeing now is CEOs and COOs and CFOs are much more aware that, especially in the self-funded world, cancer claims are typically their number one or number two payer. And what that means is that is their greatest expense on their claims payments. When we are reducing claims, we are literally putting money back into the self-funded employer group's bottom line because of the fact that they put money aside for each patient, or each employee each year and say, we're going to cover this much of their claims, this dollar amount. Well, when we are reducing inpatient hospital stays, ER admissions, medications that are being refilled or written when they're already in the home just out of protocol, gratuitous testing being duplicated, all of those are reducing claims payments. We're making sure that the patient has the best possible outcome because they have an objective set of eyes that are there for them. We're not there and beholden to the company. We're not beholden to their stop-loss carrier or insurance company. We're not beholden to the facility where they're receiving their treatments. And we're not beholden to the physicians who are delivering those treatments. We are beholden only to the patient themselves. And so we're providing better outcomes. We're providing more compliant patients for the physicians and the treatment providers. And we're providing better employees who are more focused and productive. So that ECAP program is it's monumental in business nowadays.